I'm just going to talk about today the development and launch of the eHealth Research and Innovation Network, ERIN, that we worked on yesterday. It was something we brought together, and it was a really exciting day. So I just want to give you a flavour of what that was about, and I'll be pretty quick, and I'll bring you on to the next series of speakers. So in terms of an overview, I thought it would be best, I was thinking about how to structure it, and I thought pre-launch of the network, the launch, and then what's happening afterwards is the best way to do it. But really the three things that are going on here, we were talking about innovation, research and capacity building for eHealth in Ireland within the research, particularly within the research community. So eHealth refers to the deployment of digital technology in the context of healthcare, okay, it has particular impact more recently, or it has the potential to and is having an impact, particularly in healthcare administration rollout with practitioners, but in individual care and self-management, and at a population level. Okay, so eHealth is, in terms of moving forward, it's the next probably the big place, or the next place to go for the likes of the HSE or the NHS. In terms of the process then, I just thought I'd reflect on, so this is pre the event, I suppose, and getting into the research and why this came about. This was just a way to probably structure how we were thinking. So we start at whatever level you're starting at a person, at a community level, or at a population level. There's a problem, question, or challenge that we'd like to address. And in this process, from research, we move into innovation, we move to a solution, and hopefully we have some impact. And obviously this is not a linear process. They all feed into each other. And we try to, I suppose, address these from different perspectives, or we come at different points. So within Ireland then, this was the stakeholder community. When I was looking, I suppose, when we started our research programme, I was looking at who's involved, what's going on. And you can see that there's a massive organisations across from healthcare. So you have the HSE, Health and Wellbeing Division, eHealth Ireland, there's hospitals, primary care, Department of Health, healthcare providers, moving into then the private sector. So you have SMEs, multinationals, and then into startups. And yesterday I realised we were speaking to Clyde, who'll be speaking later on. There's 130 startups in the area of health tech in Ireland. So you have this myriad of people connected in eHealth, all doing similar things, or all building on expertise, but potentially working in silos. So as we were working, I guess there was an opportunity, or what we saw was a vast, rich and diverse eHealth infrastructure with the opportunity to coordinate these in some way and connect for greater impact. So in terms of our body of work here, just to give you kind of a case study in terms of, we were one, if you look at this previous slide, we were just one section there, the eHealth and mHealth group here. But in the vast scheme of things, this is the amount of work that's going on here in our group, or work that I'm actually particularly involved in. So we have a scientific programme which has maybe 5 studies, and we're currently working with the HRB, TMRN now with one of our RCTs. Basically we have multiple studies, we have multiple capacity building programmes, and we've lots of work in terms of collaborating. So there's a rich, just within the small spoke, there's a rich programme of work going on in eHealth. So the idea came then that when we were working through our programmes, you get so far, you might conduct an RCT and you drop off because there's maybe the impact, there's no take up in terms of the solution you might be providing. So we just thought there was an opportunity to connect this community and engage, I suppose, the stakeholders on the left, and this is not exhaustive, this was just something put together, to produce a network that would provide or highlight expertise, provide accessibility, identify priorities, widen the community engagement, improve industry partnerships, and build on collaborations between different research groups or different individual researchers, or even if you're starting out in terms of building a research career, seeing what's going on. So it just came to a head that we thought, okay, how can we start this? How can we launch this network? And we went to the Irish Research Council. They had a new foundation scheme which provided funding, I suppose, to start these kind of innovative projects. So we got awarded this, and we started the eHealth Research and Innovation Network. So the initial aims, so this was the initial aims put into the programme, was to, I'm sorry, I'll just read these out because it's clear that way, but they were to facilitate knowledge sharing and knowledge transfer between digital health stakeholders to address population health needs, increase digital health research capacity by improving pathways for collaboration and ultimately the quality of provision of digital healthcare in Ireland, facilitate and accelerate the development and delivery of quality digital health interventions for population health needs, identify at a population level the digital health research needs and priority areas to conduct research, and facilitate the transition of digital health research into industry and practice. And I guess where this came from was, I know that the HRB have done a lot of work with establishing research network trials in, for example, primary care, stroke, the Health Research Methodology Network. So something similar within our field, I guess. So yesterday, anyway, was the launch event, and we had a fantastic day, I hope, anyway. But it was really rich in conversation, rich in different stakeholders' engagement. And we had, in the morning session, we had, I suppose, key stakeholders from the HSE, and outlining, I suppose, the vision of what's actually going on in our national healthcare programmes, particularly, obviously, with eHealth Ireland. And then moving into an afternoon where we talked about innovation, innovations in research, what's going on in research, and then moving into funding with Dr. John Dinsmore and Miss Adele Murphy, talking about funding and sustainability for a programme like this. So it was a really great day, I suppose, and sparked a lot of conversation, a lot of interest. So I just thought I'd reflect on, I actually have, yesterday when I was working there, I have bundles of notes scribbled on paper as to what we were supposed to do, or what could come out of this. And I suppose the key things were, and I've just got some quotes here, but from an opportunity, and this was from one of the HSE stakeholders that was there, they were saying that it's a huge opportunity for technology to change and transform the health service and make it sustainable over time, and that the network that we were starting could feed into that. From a research insight, it was really interesting to hear key people like Dr. Gavin Doherty, who was talking about the good design. So when you're developing your eHealth interventions and so on, design is key to making it, to enable good science, because if people don't use it, they won't participate, you don't get the data. And establishing the need, I think it was Dr. Deirdre Walsh was talking about her projects with MedX and Insight, just talking about the idea that, you know, when you're building one of these platforms of this research, you need to obviously engage key stakeholders from the very outset, or else there'll be no participation or no uptake of your program, or you might actually be solving something that doesn't need to be solved. And I think she talked about that with a cactus plant or a plastic trolley kind of idea, which was quite good. So it was kind of nice. She brought in the stakeholder from the start. And then in terms of funding, we moved into, and I think like Dr. Dinsmore gave a fantastic oversight as to what's available out there, right from early career people right up into EU funding, and how it's accessible and attainable. And I think it was really clear just that there's so much that we can do, and there's more and more funding is going to be brought on in line with this. So what was key, though, I think one of the points he was making was that we understand the impact of what this group could do, this network could do, and therefore improve chances of obtaining EU funding. So as a way, as a vehicle to go towards EU funding, but understanding the landscape, I think, was key. And from the day, one of the biggest things was that we were looking for, obviously, collaboration. And I believe at the end of the day, there was a discussion between, I think, actually, Dr. Dinsmore and Mrs. Adele Murphy, just talking about, because they're working in multi-morbidity, stuff that they could do. So there was like already a synergy or collaboration established on day one, which was one of our tasks or one of our goals. So that was just what was happening. So in terms of what we, at the end of the day, then we had a discussion and we described what we could actually do, so what we could build from here. And I think it was brilliant to see everyone across the board engaging with this. And I suppose one of the key things was if the group came together, we could feed into the national eHealth strategy, so have a voice. Capacity build in eHealth training, and that was particularly interesting with the idea of developing people in their early careers, which I thought was brilliant. Developing people in their early careers as they progress in this area, supporting them. Identify ways to build in cost effectiveness for interventions, how to scale the QUIC programme, so it's an eHealth Ireland's quality innovation corridor, so it's a way that you bring eHealth or digital tech through. Aggregate what we are doing right now to reduce the noise and tech solutions out there, and leveraging social responsibilities commitments from large tech companies. And finally, I think one of the conclusions was that we need to provide something concrete to offer the HSE. So I hope you can all read that. Actually, it might be a little bit small. But I think the key thing was that we'd have a national communal voice, we'd build a product or have something along those lines to give to the HSE. Education, which was critical, particularly early career researchers, postdocs to PIs are moving people into that position. Develop a model of sustainability and a vision and brand. Bring a vision and brand, or I suppose a voice again for this. So there were the conclusions really from the day. So in terms of our next steps, well, we have an ERN webpage. It's the eHealthResearchNetwork.com is there. We started our social media, so it's @ResearchEHealth. So it's just to kind of increase the visibility of what we're going to do. There is a mailing list, so if you're interested in getting in touch or being on that mailing list to see how we're going to develop, go to the eHealthResearchNetwork.com and just sign up. It's under Connect. You'll sign up there in the mailing list. And the last thing we discussed was a management committee, and we have people, key stakeholders in the room yesterday that agreed to be on a management committee. So we're going to work towards, obviously, engaging them now and seeing what we can actually do. So that's pretty much the, I suppose, grounds here, the start of hopefully a really great collaborative network that will actually move eHealth research forward in the national perspective, but put it on a map. And I will say, please do get in touch and contact with us, because it's about everyone participating in it. So thank you very much. That's just an overview of that. And yeah, there you go. I'll bring on stuff.